Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, we welcome back Dr. Andy Pekos, a virologist, and Dr. Megan Davis, a veterinarian, to give an update on the developing story of the spread of avian flu beyond birds in the United States. Stephanie Desmond asked them about the threat to the milk supply, to other mammals beyond cows, and why the situation is testing the systems put in place to keep people safe after the COVID pandemic. Let's listen.
Megan Davis and Andy Pekos, thank you both so much for joining me.
Great to be here.
Very happy to be here.
So the three of us had this conversation a month ago. We talked about the H5N1, which was being found surprisingly in cattle and in a farm worker. But the things have really changed since then. So I'm wondering, Andy, if you want to just start, give us the lay of the land right now.
Absolutely. From the virus side of things, we had a big data dump from the USDA, the Department of Agriculture, that put out a bunch of sequences of viruses that were sampled from cattle in different farms in different states. And it tells a really fascinating story that it looks like this H5 virus underwent what we call a reassortment event, meaning it swapped some of its genes with another avian influenza virus. And that virus seemed to immediately emerge in dairy cows. And it seems like all of the different outbreaks that have been tested so far in different states all trace back to that one exposure of a dairy cow in a farm in Texas to these avian influenza viruses. So it's what epidemiologists call a common source outbreak. The virus just made one jump and has now been able to spread between cows and across state lines and into different farms through the movement of infected cows. The other interesting thing about that data dump is they also had sequences of animals who had, in many cases, died on some of these farms, both wild animals as well as animals like cats that were on the farms. And those viruses are completely related to the cattle viruses. So we're now seeing a situation where one introduction into cows has led to all of these different outbreaks. And now as these cows move, other animals on those farms are getting those same viruses. So it's really tells us that there's a pretty comprehensive spread of this virus when it gets into these farms, not only among the cows, but to other animal species. I think the other important thing to note is that so far the viruses are picking up mutations, but nothing really that would suggest that they're getting closer to adapting to humans. That's something we didn't know about what would happen with animals. Oftentimes, viruses can evolve in animals to be specific to that animal, but whether those mutations make them easier to jump to humans is a big question mark, especially with something like cows where we don't have much experience with. So somehow we're seeing mutations, but nothing that strikes an alarm yet that the virus is getting closer to being something that could infect humans.
But they are getting sick, right? I mean, there was at least a farm worker in Texas, Megan, who got sick. Talk to me about the risks to which humans are at risk.
Absolutely. So the human who was infected, we don't yet know the exposure route explicitly. If, for example, it was a splash from milk or if it was some other route of transmission. The person had pretty mild symptoms, was primarily conjunctivitis. So you'd think about pink eye as being a kind of conjunctivitis. So similar to that. I'll say as a former dairy veterinarian, I'm not certain that if I were in practice, I would notice and think that a conjunctivitis might be related to high-path avian flu. I would be just as worried that I got a piece of barn dry in my eye and it's causing some mechanical irritation. So with mild symptoms like that, it may be possible to overlook symptoms. So we may have more workers who have symptoms than we recognize. One of the things that really concerns me is that we have not had very widespread active surveillance in the dairy workforce. This includes people who are doing the milking, and we know that the virus is shed quite a bit into the milk, and so that is a potential route of exposure. We don't yet recognize, for example, within the dairy parlor, if there could be some other routes of transmission, like through the air or even through fomites, through contact. Like if they get exposed to milk on their gloves, but there's a little bit on their hands and they don't do a good job hand washing and then they eat something, is that a potential route of exposure? And we don't know to what degree the dairy workers are following the recommendations for extra personal protective equipment. I'll just say when I was in dairy practice, it wasn't very common in the culture to use more than coveralls and gloves, certainly not wearing respirators, face shields, goggles, and all of the other pieces of personal protective equipment that the USDA and CDC are recommending. So because of this, I think a shift in our strategy to really focus on this workforce and also recognize that there are many of them who are what we consider to be vulnerable workers, meaning because of immigration or migrant status, they may not have great access to healthcare. They may not be part of our human surveillance networks for influenza. So my question is, would we even pick them up if they're in these rural areas where healthcare access already may be challenged? And then there are additional challenges to access healthcare because of immigration or migrant status.
Testing's voluntary, right?
Testing currently is voluntary, and it's not clear to me to what degree it's voluntary at the farm level, meaning that the dairy producer or dairy farmer would be in charge, or if it actually is an option for each and every worker to make that choice for him or herself. The other thing for us to consider is that it's not just the workers with the cows on the farm. You also have milk truck drivers, you've got haulers who move animals from state to state or within state, and you have processing plant workers for both milk and meat products who may come into contact with potentially infectious material, particularly the milk processing plants.
Well, we have to talk about milk then right now, because that's been a huge conversation, right? So my understanding is that pasteurized milk, the milk you buy in the grocery store, does not have live virus in it, but it does have dead virus in it. And so what is that telling us?
When you have pasteurization, the whole goal of it is to kill the things that are in it that might cause you harm. And that includes bacteria and viruses. And we usually see some bits of them left after that you can detect on tests that are molecular, like PCR tests. What we've seen so far is there's been additional testing to be sure that there's nothing infectious remaining, that is, that pasteurization works. Now, I will say a little cautionary tale. I've been in grocery stores in the United States where raw milk is sold right next to pasteurized milk. And there was a moment when I was reaching for milk and I didn't realize I picked up raw milk. So I think it's very important to be cognizant of labeling if you are a consumer who's in an area where raw milk sales are available commercially. And I always recommend and have recommended not to drink raw milk products and not to share them with your pets either, because we certainly are seeing with these poor cats on the dairy farms that have gotten very, very ill and died that it can be extremely bad for animal health.
And we also know with H5N1, when human cases have occurred, the vast majority of them are people who are involved in slaughtering chickens, getting exposed to chickens, or eating undercooked food from chickens who are infected. So the fact that it's in the milk and you're eating it, and maybe H5N1 and everybody thinks it's a respiratory virus, that's still a route that you can get infected with because your mouth and throat and everything are all interconnected, and that's a known route of exposure. I guess I'll also mention there's lots of other reasons not to drink raw milk besides avian flu. Certainly this maybe, I hope, is a means of bringing up that safety issue back to the public's attention. Even before H5N1 was detected in raw milk, I wouldn't really be drinking raw milk under any situation.
Absolutely. I completely agree with you, Andy.
They sell it at the farmer's market in Baltimore for animal consumption only. It sounds like a bad idea to give it to your animals.
I do not recommend that you give it to your animals. We certainly know that both dogs and cats are susceptible. Ferrets are very susceptible, and obviously other species as well. The ability of this particular clade to get into mammals has been really concerning. And we've seen not just major die-offs within wild bird populations, but also within wild mammal populations, including some of our marine mammals.
Yeah, like seals and dolphins, even polar bears, I think they've found
Yep,
it.
even a polar bear, squirrel.
Yeah.
It's a long list. I counted 19 or 20 different species in the United States of mammals that have been affected, many of them with mortality.
Which brings us back to how concerned should the general population be? Is this a potential pandemic for humans?
Well, I think that there are some of the basic things that people have to pay attention to in terms of their day in, day out work, right? I think coming into contact with any dead animal is always something that you should probably not go poke a stick or mess around with them. But for most individuals, the outbreaks that are going on in wild birds, we have very little contact with those wild bird populations, right? And so for the average individual, the chance of getting exposed to a migratory bird that happens to be H5N1 infected in a manner that would get you exposed to the virus is incredibly low. The dairy cow farm workers that Megan talked about before, that's the critical population right now, because we believe that they are coming in contact on a daily basis with multiple cows, some of which are showing symptoms, some of which may not be showing symptoms, but that have virus both in their milk as well as in their respiratory tract. So it's really focusing in on those people who are now coming in contact with infected cows, because that represents the nexus, the place where the virus can move from an animal to a human. And that's the critical thing for us to limit if we're going to prevent another potential outbreak or pandemic.
And I'll just add that this workforce are really also the potential front lines for us in terms of surveillance. Not just that they could be exposed and get ill and we need to protect them, but also that they know the cows. When I was in vet school, we took a veterinary Spanish class to know all of the different Spanish words for the different kinds of health conditions, because that's not what you get taught in Spanish 101. And this was because our migrant and immigrant workforce in California who worked on the dairies really knew the cows, and a number of them were not English speaking. And so we got so much information from them that was really the point where the veterinarian interfaced in terms of the animal health histories. And I need to note that these cows are getting sick in ways that cows just typically get sick from lots of other things. They're not eating well, they're not producing much milk, they've got some gastrointestinal signs. It's not something where you look at the cow and say, oh, that cow has flu, right? Yeah. So that's really critical to recognize when you're starting to see numbers and types of animals that have these conditions in a way that's atypical on the farm. And that takes people who know the farm, who are on the farm every day working with the animals. So I think this is an untapped resource for us to be able to use for a very important public health surveillance function.
We just have gone through, some might even argue we're still in a pandemic, right, from COVID. And I'm hearing that coordination on this new virus is been slow. It's been shoddy in some ways. And I'm wondering, have we not learned the lessons of the COVID pandemic?
I think we know what we would like to do. The problem, as is always a problem, is in the implementation of that, right? We have dairy farms that are subject to different jurisdictions based on what they're making, where they're shipping things, agencies that are responsible, like the CDC for human infections, the USDA for more animal infections. Some of the local work is also local public health and Department of Agriculture have responsibilities. The FDA is pretty much responsible for things going on the shelf, but also going across state lines. So everybody has their own little slice, but we haven't been able to really coordinate across those to get a much more comprehensive look. I always say the first thing you should do in a situation when you think there's an outbreak on the farm is to start testing anything and everything on the farm, so you have a full and complete assessment of what's going on that farm. But It turns out you can't mandate that. A lot of that becomes voluntary. And then there are a lot of other issues that are completely not scientific related, right? That prevent the implementation of that plan. That is something that we hear about a lot. You can have the best plan, but implementing it is where the real hard work comes, particularly for pandemic preparedness.
I think this is a perfect test case for how we need to think about our One Health response systems. So we think about prevention. We don't want any spillover. We think about early detection, which it seems we may have missed. And now we're talking about response and other containment strategies. This is a very useful case because dairy have not typically had high-path avian flu as a challenge. And so this industry is undergoing this situation in a new way. Whereas the poultry industry has struggled with high-path avian flu, Newcastle, and other viruses for a long time. And there are many different policies and procedures in place at the integrator level and at the government level to help make that, I hate to say it's a well-oiled machine, but this is something that they deal with all the time. So this is our perfect dress rehearsal, right? This is exactly the kind of thing where you want to figure out how to overcome these barriers and put new laws and policies into place that will enable either, if this particular clade does show signs of evolution and further adaptation to humans, it's certainly already an issue for animals. Let's not discount the importance of this virus in terms of animal mortality. But we then also have the opportunity to prepare ourselves for something that could be worse down the road.
So let's say I have you guys back in a month. Where will we be, do you think? Megan?
Well, there's where I hope we'll be, which is that we'll have moved into more active surveillance. We will identify if we need to do further mitigation strategies like restrictions of any sales within state, not just across states. Improving our ability to get access to healthcare for the workforce, and also making sure that we can tap them for their essential functions in terms of public health coordination and response by being on the front lines and being our eyes and ears on the ground. That's where I hope we'll be. I think it may take longer than a month is my guess.
And I hope from the virus side of things that we'll start to be able to see if some of the mutations that these dairy cow viruses are picking up are just sort of genetic fingerprints of the virus moving through the population, or if they're actually changing what the virus can do, particularly in the cow population. Because right now, nothing looks like it's a signature of change, but we have to do some experiments because things are new, things are novel, and we haven't expected this type of scenario before.
Megan Davis and Andy Peckosh, thank you both so much for joining me.
My pleasure.
Wonderful to be here.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Ceciri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Ceciri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.